Assalamualaikum and hi, I'm Nur Anis Atika. So today we want to present about our assignment 1. Regarding to our assignment 1, we have choose amnesia and cognition as our topic. So I will present the abstract and the introduction of amnesia. Amnesia or memory loss is a disorder in remembering as well as difficulty forming new memories. Regarding to our report, we have discussed more about amnesia, such as its causes, effects, and treatment. Amnesia is characterized as a condition, a short-term or everlasting memory decline. It can happen whichever to damage to some areas of the brain. There are also several types of amnesia. Besides, this disease is usually happening to adults where they are unable to remembering the past since early childhood. So that's all from me. I will let my friend to continue this presentation.
Next, I will talk about the causes of amnesia. Generally, various causes lead to amnesia such as traumatic brain injury, neurosurgery, lack of oxygen to the brain, viral infection, alcohol intake, stroke, epilepsy, and even due to diseases. For retrograde amnesia, which is the disability to recall past memories, the causes include cardiac arrest, which will cause people to stop breathing, resulting in the brain being deprived of oxygen for several minutes, which can lead to serious brain damage. The second one is due to degenerative brain disease such as Alzheimer's, and the last one is epilepsy or seizures that can bring damage to the brain and cause memory problems. Meanwhile, retrograde amnesia, which is the disability to retain new memory or information, it may occur after one starts experiencing some symptoms of short-term memory loss. The other cause is due to threatening epileptic seizures, which the medial temporal lobe will be removed from both of the brain's hemisphere, which can bring damage to the hippocampus in both halves of the brain. Also, some causes can be related to both of these types of amnesia. One of them is a traumatic brain injury that resulted in damage to the memory-making parts of the brain, such as the hippocampus and thalamus. The second one is due to viral infections such as herpes simplex that resulted in encephalitis, which is an inflammation in the brain that could cause damage to the memory storing parts of the brain. The next one is thiamine deficiency, which causes by chronic alcohol intake, lead to a condition called Wernicke-Korsakoff syndrome that causes problems in learning new information, inability to remember recent events, and long-term memory gaps. And lastly, this amnesia also can be caused by stroke, which leads to brain injury and damage.
Effects of amnesia. The general effects of amnesia is memory loss or inability to form new memory and difficulty in retrieving memory. There are two types of memory, declarative and non-declarative. Declarative memory is memory such as facts or events stored in brain to be recalled. They are affected by amnesia. Declarative memory can be divided into two, semantic and episodic memory. Retrograde amnesia results in loss of semantic memory. Anterograde amnesia causes inability to create new episodic memory. On the other hand, non-declarative memory is memory that link to skills and learning that are acquired by practice rather than recollection, so it is not affected by amnesia. This can be proven when patients with anterograde or retrograde amnesia may practice to form new non-declarative memories, and they show some improvement in learning abilities after some time. Type of amnesia and its effect. First, retrograde amnesia. The effect is lost current memories, which affects new memory, and childhood memories typically influence over time. Next, anterograde amnesia causes inability to form new information. The effect can be either short-term or permanent. The example of short-term effect is blackout caused by overconsumption of alcohol, and the permanent effect is when hippocampus is damaged. Next, transient global amnesia (TGA) causes confused or anxious several hours, and lost memories hours before the attack. Lastly, infantile amnesia, or known as childhood amnesia, which is a common phenomenon. The effect is forget the first 3 to 5 years of life.
Hi, my name is Putriani Amisha binti Reji and I would like to explain about treatment for amnesia. There have many types of amnesia, but I would like to explain 4 types of amnesia and the treatment. The first one is retrograde amnesia. The second one is anterograde amnesia. Third is transient global amnesia, called as TGA. And the last one is infantile amnesia. Retrograde amnesia treatment. The first one is occupational therapy. Patient will learn new information to replace all memories that have been lost or that have been forgotten. It takes the form of using old memories to store new memories with the help of therapies. And the second one is by technology. Retrograde amnesia treat by using technologies such as gadgets, which smartphone and tablets. By using that, it can create new memories of the old and can store new and old memories in the form of picture and videos. Anterograde amnesia treatment. The first one is vitamin D supplement. An application of technology is to some extent helpful, such as application of reminders, pictures, and videos. Transient global amnesia. They have no treatment, but surely TGA will resolve by itself within 24 hours, and TGA episode usually lasts less than several hours, and the worst one is happen for 24 hours only. And the last one is infantile amnesia treatment. Infantile amnesia treated by the first one is talk about the past, which is a discussing experience such as childhood memories and then writing down about a childhood memories. The second one is look at the photos. This is because photos help to recall the memories back. And the last one is revisit familiar areas. It will help we notice some nostalgic smells that remind of your old days, and from that you will start to recall the memories that has happened before. That's all for me. Thank you.
Hello, I'm Alfa Shakira. I'm a last presenter. I would like to present about new insight and perspective about amnesia. Some people confuse about amnesia and Alzheimer. Amnesia is affect person psychological and Alzheimer is affect person psychological, emotional, and physical state. Amnesia is classified in 4 types, which is retrograde amnesia, anterograde amnesia, transient global amnesia, and infantile amnesia. Amnesia is not present since birth, but it happens through of factor and situation. Amnesia caused by brain injury, especially in temporal lobe area. Basically, most people think the causes amnesia by accident. The other factor causes by accident, head injury, physical trauma, and post-traumatic stress disorder. In conclusion, if someone has amnesia, do therapy to improve their memory skill and learn new information. Besides, staying mentally and physically active in your life to prevent amnesia disease. Hence, beware from high risk of injury because it also can prevent amnesia disease. Hopefully, this video can help you all about amnesia disease. Thank you and stay safe everyone.